the medical hazards of obesity. So lots on obesity right now in our popular culture. I'm going to give you some references at the end, just asking you to kind of open up your brain, your mind, and thinking, as I'm sure many of you had, to put a critical lens on what we're talking about when we're talking about obesity. So again, maybe we should change it to the medical hazards of insecure living conditions and how that can impact these items. So this Guy Donaldson was the former Minister of Health in Canada, and he had released a top 10 list of things that individuals should do if they want to lead to a better and healthy lifestyle, better and healthy lives. So very briefly, don't smoke. If you can, stop. If you can't, cut down. Follow a balanced diet with plenty of fruit and vegetables. Keep physically active. Manage stress by, for example, talking things through and making time to relax. If you drink alcohol, do so in moderation. Cover up in the sun and protect children from sunburn. Practice safer sex. Take up cancer screening opportunities. Be safe on the roads. Follow the highway code. Learn the first aid ABC, airways, breathing, circulation. So in response to this, when this came out, those in the mindset of looking to critique this very individualized examination and suggestion of how individuals can improve their health, social determinants of health folks came out with their own top 10 tips for staying healthy that I think reflect more accurately what it is to try to be healthy in our society. So for example, don't be poor if you want to be healthy. If you can, stop. If you can't, try not to be poor for long. Don't have poor parents. Own a car. Don't work in a stressful, low-paid manual job. Don't live in damp, low-quality housing. Be able to afford to go on a foreign holiday and sunbathe. That vitamin D is very important. Practice not losing your job and don't become unemployed. Take up all benefits you are entitled to if you are unemployed, retired, or sick, or disabled. Don't live next to a major busy road or near a polluting factory. Learn how to fill out the complex housing benefit asylum application forms before you become homeless and destitute. So hopefully you're seeing the irony. So what I'm asking you to do, and what this whole field of research and writing and presentations and movie making is asking you to do, is when you see the ads, when you read the research that blame the individual for their particular health issues, we're asking you to consider some other ways of looking at this. The idea of lifestyle choice is heavily structured by life circumstances. You might want to consider that lifestyle choices by themselves account for a modest proportion of health status. And if you're not convinced based on what I've given you today, which makes sense, there's lots of research out there showing this. Lifestyle choices are difficult to change without considering life context. So what is it that doesn't exist in somebody's life that will support them to quit smoking, for example? Lifestyle choice emphasis can have unintended side effects that work against health. So this idea that, well, let's use smoking for an example. For me, I don't know how many of you have tried to quit smoking or have smoked, but all these lifestyle messages that I receive from my media and my community about, the black lungs and makes you look old and you have stinky breath and the causing the taxpayers' healthcare costs, all those things just made me feel really yucky about myself. It didn't make me feel good about who I was as a person in the world. What finally actually got me to quit, I think overall, was this idea that I wanted to be a different person. I wanted to be a person who doesn't smoke, that I have things I want to do, activities I want to do, and I need my lung capacity to be able to do them. It's about me wanting to be an active, participating person And so it was more of a positive way of looking at my life rather than this individual blame idea that I'm a bad person because I smoke. So back to heart disease. What is the cause of heart disease in women? How many of you said smoking, obesity, physical inactivity? Some of the research, New England Journal of Medicine, very prestigious journal, research journal, found that those living in lower income areas were much more likely to develop coronary heart disease than those living in well-off neighborhoods. These effects remain strong even after controlling for tobacco use, level of physical activity, presence of hypertension or diabetes, level of cholesterol, and body mass index. That's the whole measure that is used to determine obesity, which is a very faulty measure according to some folks. So, not to belabor it, hopefully we're getting the hint that that this focus on individual factors for coronary heart disease, cardiovascular disease is actually perhaps inaccurate, that we should look at higher up things like low income is a major cause of cardiovascular disease in Canada. Social exclusion provides a process by which low income can be understood. Canadian policy directions are inconsistent with what is known about reducing the incidence of cardiovascular disease. So our politicians are saying, and our policies are saying, encouraging us to get more exercise. But really, our housing stock, our poverty, is what might be causing our heart disease. So lifestyle approaches and messages are not only inaccurate, but potentially damaging to population health. The health sector and media have been negligent in ignoring the role of social factors played by CVD and other diseases. So, what determines a woman's health? Like I said, we're going to be touching on trans women this week and talking about women. So I'm going to leave that for you to answer. When you think about what we're covering in terms of the psychology of women and trans women, what would determine their health? What are we going to do about all this? Part of your reading this week is to explore that, how we can make change if we're interested in considering the social determinants of health. If you are, you're not alone. There's lots of resources and supports out there, lots of people doing work. In fact, our government at one point in the late 90s was very interested in the social determinants of health. That has definitely fallen off the radar in terms of our new government. So our government at one point actually said, in the case of poverty, unemployment, stress, and violence, the influence on health is direct, negative, and often shocking for a country as wealthy and as highly regarded as Canada. I would concur. Like I said, there's lots of resources out there. The World Health Organization just published this. They're looking at the social determinants of health. Public Health in Canada did a report specifically linking this. They have their own charter of public health, the Ottawa Charter. This is from the Association of Health Centers. They're looking, community health centers that you've heard me talk about endlessly. Definitely look at a social determinants of health way of approaching individual health. Lots of different organizations are doing work on this. So these are just some of the resources if you're interested in exploring further. But I hate to say it, it's really up to actually if change is going to be made. I personally think that it's going to be up to us, you and I individually, not some report or plethora of reports, if change is actually going to happen. For those who feel like it's too big and too daunting, Tommy Douglas, who was one of the main founders of our healthcare system, pushed in Saskatchewan, a province that was dead set against, all the doctors were dead set against Medicare. He charged forward and asked us to have courage. It is not too late to build a better world. I'm going to leave it for now. There are a couple more slides that summarize some of the ideas for making change, but that will also be part of your reading this week. Take care, and I look forward to talking to you or reading your post soon.